1 in 8 men will be diagnosed with prostate cancer.
The deadly disease is the most common form of cancer in men in the UK. 1 in 8 will get it.
We know that prostate cancer deaths are now the third biggest cause of cancer deaths in the UK.
Denton was diagnosed with prostate cancer and survived, but he only went for a checkup after his father Benjamin died of the same disease.
That we somehow, in the same way we don't ask for directions, we just don't like it.
Our former colleague has revealed that he is suffering from prostate cancer. The 62-year-old broadcaster that he wants to encourage men to get tested.
We don't want to waste the doctor's time, we don't want to waste our time, we don't like going to the surgery. Why would we do that? Naturally we're reluctant to go. Now, of course, I'm a season ticket holder in my local surgery.
In 2015, I was diagnosed with prostate cancer, and since then, I've been on a journey of treatment and recovery. It's given me an in-depth look at some of the things you, or somebody you know, may go through. In this film, we go behind the scenes and meet some of the brilliant doctors, nurses, consultants and scientists working in the world of cancer. Each person's experience is unique, and I hope sharing mine with you may help to demystify some of the things you may encounter. Most important, this film is about living as well as possible with cancer. The good thing is, we talk about it now. It affects so many people. However, we now know that with the right knowledge, the right attitude, swift and early diagnosis, we can live a full and relatively normal life. Medical science is making astounding breakthroughs. So, if you suspect that something is not quite right, don't be embarrassed. Go and see your doctor.
So, in a consultation, well, firstly, what I want to do is listen. Because every patient has a story, and I think to treat them properly, you've got to hear their story. And then that guides my route through this joint consultation. A lot of the symptoms that people come and see me about, for example, is it difficult for you to start going for a pee? Do you find that you have to urgently go for a pee? Do you find once your stream is there that the stream is as good as it once was? Other symptoms can be getting up at night excessively to go to the loo. What about at the end of having a pee? Are you dribbling on a bit? And that can be upsetting and bring people in. I mean, there are other things like blood in the urine, erection problems. Some men want to come in and discuss it very much privately and alone. Others, it's their partner who's pulling them through the door by the ear, saying you need to get this sorted out. If you look at this journey, if you like, there are many destinations, and it's not always clear how things are going to turn out. But one thing is certain, for many people, this involves real change. And that can be difficult, and that can lead to anxiety. What I think most GPs are probably going to want to do, if they're worried about prostate cancer, is a straightforward examination of the prostate, the DRE, or digital rectal examination. Now, of course, this is something that strikes fear into many men, and I think a lot of people have sort of images of James Herriot. But let's be quite clear about what it involves and what it doesn't. So the prostate sits up the back passage, and so it's easily amenable to be felt by a finger. So what I do is I get the gentleman onto the couch, get him to lie down on his back, get him nice and comfy, and then roll over onto the side. Just flip his pants and trousers down there, and then put a finger in to have a feel of the prostate.
Right, and how about the PSA test?
The PSA, or prostate specific antigen test, is a blood test, so quite quick and easy. And often men will rather have a blood test than have a doctor put their finger up the backside. And I can certainly understand that. But I think it's important that we have a discussion about the pros and the cons with the PSA test. If I've got a suspicion that there is a prostate cancer here, be it on an abnormal rectal examination or with a high unexplained PSA result, then I would be referring them up to the urologist under the 2-week rule. And that's a pathway that we use for suspected cancers.
So, from a reasonably active, normal life, you find yourself on a conveyor belt. A strangely comforting process. You're in good hands. When you're first diagnosed with cancer, it can be a shock, a very stressful time. It's normal to feel isolated, and you have that feeling of, no one understands me. What am I going through? But I know some people who do understand, and know exactly what you're going through. Many men find themselves calling helplines. Let's head up to London and Prostate Cancer UK and meet the faces behind the phones. Hello, how nice to see you all. I'm Chaloner. How do you put that first caller, that first time, how do you put that man, or indeed his partner, because partners also, I'm sure, call, how do you put them at ease and at feeling comfortable?
It's finding out what, at the beginning of a call, what they understand about their situation, what they've been told, and you get a lot back from that as to whether you need to clear up any misunderstandings or misconceptions about their situation. And then just taking it slowly at their pace, using the right sort of language, using the right sort of terminology. We become very medicalised in the way we speak in hospitals, and so often making sure that people understand what it is that they've been told, using very straightforward language.
Some people think I need counselling, and often I think that may be useful, but it's often support and information that really, really helps. And you might hear them say, actually, I don't know if I do need counselling. I didn't know this, I didn't know that. We try and demystify a lot of the worry they have. And nothing is stupid, you know. This is a stupid question, and stop phrases, there's no such thing.
No man's cancer is exactly the same. It's not that there's a one-size-fits-all when you're dealing with prostate cancer. So it's really important when that man is at the end of the phone to get all the relevant information that will enable you to be able to really meet that individual's needs, because we need to know what they've been told by the doctors. We need to know as much of the results as we possibly can, because the grade of prostate cancer, the stage of prostate cancer, these are all important elements in terms of perhaps helping somebody to come to a sort of decision around which particular treatments to consider. And we go through considerably in terms of the pros and cons of all the various treatments that they've perhaps been offered.
So let's go and meet my consultant, James Hicks at St Richard's. James was the consultant who diagnosed my cancer and gave me the news.
Many patients, not all, but many patients with a raised PSA will be referred as a 2-week rule patient to the hospital and start on their investigation. And then they'll be moved on to the more complex investigations that we do. Those are really two quite complex procedures. One is the MRI scan of the prostate, and the other is the prostate biopsy. So an MRI is really a fantastic test that has changed our world in prostate cancer management, for the simple fact that it gives us, ideally, a target. I'm very glad to say that most patients' results are pretty straightforward, and although they're cancers, they do direct us to a relatively straightforward recipe of treatment. The very complex patients, fortunately, tend to be few and far between, and they're the ones that will take a lot of discussion where we draw on surgeon expertise, oncology expertise, but most importantly, the pathologist and the radiologist who do that stage and grade assessment. If I take a patient through an all options discussion, so they may have relatively milder prostate cancer, and they may be suitable for surveillance, they may be suitable for surgery, brachytherapy, external beam radiotherapy and hormonal treatments, or even HIFU, which is an exciting new technique, but all of these things need to be discussed. And it's very difficult if a patient doesn't know what any of these things are. So a little bit of homework before the patient comes through the door makes my job infinitely easier to take them through all those options. Of course, one of the nicest parts about the job that I do is actually seeing patients. And patients shouldn't forget that we like seeing them, we like talking to them. The trouble is, we don't talk to them about the football and the cricket. We talk to them about these horrible things sometimes. And that is emotionally draining. It's very difficult to pick yourself up and hit the next person and the next person, because you see the human spirit, you see the patient's strength and weaknesses all in the very same moment. When you hit somebody with the news that they have a cancer, that it may be life-threatening, to see that patient crushed inside and lift themselves much stronger within literally seconds is an extraordinary privileged position to be in. And to see the human spirit as determined and I suppose as strong as it is a very odd thing to say, but it's a very exciting part of the job. And it really is a very powerful motivator for us who sit on this side of the desk explaining things to patients.
One of your phrases I heard you say, which is absolutely spot on, was don't let cancer define your life. And for me, that was a terrific signal to get on with it, live with it, whatever the diagnosis is. Don't let it get you down. Get out, be positive and be active.
Well, you're absolutely right, because I have a patient with a name and a wife and a family in front of me. I don't have a bloke with cancer. And that's the real, much more human and exciting part of the job. And I think the nice bit about doing those discussions is trying to tailor-make the very best treatment to that individual. And I think what this a diagnosis of a cancer does is gives them a real jolt, and it makes them think about all aspects of their life. It makes them think about their families around them, what they can do to stay healthy and fit. You see the younger men think, am I going to be around for my son who's only 4 years old now? Will I be able to kick a football around in 10 years' time when he's only 14? You see the older men, you know, will I see my granddaughter get married? They're hugely powerful motivating factors go on that spur those patients to hopefully understand their cancer, hopefully start to put an emphasis on living with a cancer. So often you hear about patients dying with a cancer. Well, actually it's more common to live with a cancer, to survive the treatments that we give, to then have to change their life a little bit, some for the positive and some with the negative with side effects that occur, but hopefully change their life to look at all aspects of it, whether it be diet, whether it be exercise, whether it be stopping smoking, whether it be an attitude that just embraces living and surviving rather than the alternative.
So from the moment you leave the consultant's room, you're greeted by a team of uro-oncology nurses. They will listen to any immediate worries you may have, no matter how big or small. While some friends and family won't understand what you're going through, I know other people who will.
I think at the time of diagnosis, obviously we're at that point where we're there to support them, the patient, and to give them information about their diagnosis that they've been given. The patient may have spent a period of time with the consultant going through their results and explanation, but as we know, a lot of that information isn't taken on board, particularly when a patient hears the word cancer. Then anything else that goes on beyond that they may not necessarily hear. They've got time to ask questions they may not ask a doctor. particularly for men who are going on to hormone therapy, and there are lots of side effects that may occur with that, and everybody's individual, from things like hot flushes through to lack of libido, loss of erections, weight gain, fatigue, sometimes even moodiness, isn't it?
I think part of our role is having good people skills to try and establish which patients are the ones that want lots of information. Some patients don't want any information at all, and it's quite important for us to identify where the key points are in the patient's journey to enable them to ensure they've got the correct information that they need at the right times.
So there's a whole industry working behind the scenes in hospital, working on your tests. Your tests and scans are then discussed at a weekly multidisciplinary team meeting. So let's go behind the scenes and attend one of these team meetings. They are talking about my tissue samples.
Chaloner is 65 and presented with a PSA of 13, having gone up from a previous level of 4. He's got a strong family history, 3 brothers with prostate cancer, and he's got a palpable nodule on his prostate. So, Samir, could we have a look at the MRI? And we've also asked for a bone scan, and then perhaps we can have a look at the path.
And this is from the 18th of February 2015. As you can see on the T2...
Chaloner, as I believe Paul Carter would have explained to you, all newly diagnosed patients are discussed each week in a multidisciplinary team meeting where the urologist, the oncologist, as well as pathologists and radiologists all contribute to that. In the meeting, we would review the presentation, the results of the biopsy, and any radiology we have, like an MRI scan or a bone scan, so that we can formulate a treatment plan which we can then discuss with the patient. Your assessment does not suggest there's any disease out with the prostate. So the aim of the treatment will be to achieve local control and hopefully long-term cure.
There's a baffling range and variety of new treatments, new developments. So let's go meet oncologist Dr. Vincent Khoury from the Royal Marsden Hospital in London to talk about these new treatments.
The treatment for prostate cancer can certainly be incredibly complex nowadays, and that is because there have been remarkable developments in this area. The developments range from better imaging to understanding the molecular nature of prostate cancer, as well as some of the genetic predispositions. In imaging the disease, what we want to know is whether the disease is localized within the prostate or if it has extended outside of the prostate. A variety of new treatments that would range from radical surgery to radiotherapy, for which there are several forms, such as external beam radiotherapy, to insertion of radioactive seeds, such as brachytherapy, and more recently the use of focal therapy if the lesion is confined to a small part of the prostate gland itself. And you can imagine that if all the treatments provide equivalent outcomes, in other words, cure rates, then the only discerning difference are the profile of side effects. So it involves quite a long discussion. We can treat it in the traditional sense with external beam radiotherapy, but the external beam radiotherapy has developed in such a way that we now have special image-guided methods where we can track the prostate gland on a daily basis. And this has led to the use of stereotactic radiotherapy, where we can give very high doses over a short period of time, such that we can condense 7.5 weeks worth of radiotherapy given traditionally into 5 treatments over 1 week. And that has made a tremendous difference for our patients in terms of halving their travelling and attendance times. So I'm anticipating that in less than 5 years, we would have more exciting developments that hopefully may be able to be brought far earlier into the localized stage of disease rather than being reserved for when the disease is widespread. And when we do that, potentially we may even be able to improve the cure further.
I can hear patients and their partners breathe a huge sigh of relief. For my stage of cancer, I was treated with conventional radiotherapy for 7 weeks daily, and then hormonal therapy for 3 years. Let's go and see the latest in radiotherapy treatment at Genesis Care in Portsmouth.
So my team of radiotherapists really want to make sure, as does Genesis, that every treatment the patient has is personalised and it's unique to them. The treatments that we offer here at Genesis are more encompassing and holistic, as well as specific targeted radiotherapy treatments. So the treatment options we have available for patients are image-guided radiotherapy, surface-guided radiotherapy, which ensures the adjustment of the beam during treatment. We're also providing SpaceOR, which is quite a new and innovation for reducing the side effects of radiotherapy. And what it does is it creates extra space between the prostate and the rectum, so it protects those organs at risk. Patients that have cancer, whether it's prostate cancer, breast cancer, there are so many other things that they worry about, they think about, whether that's their personal well-being, their impact on their family. And within Genesis, we want to make sure we support the whole journey. So when the patients had their treatment, we also offer a service called Penny Bron. So Penny Bron is a charity in Bristol that we work very closely with, and they are absolutely fantastic in supporting the patients during the whole journey, whether that be through counselling, relaxation, acupuncture for pain, reflexology for nausea, and we try and coordinate all of our treatments around radiotherapy and access to Penny Bron services as well, so they've got that complete holistic journey.
These support centres are a lifeline for many patients between treatment and recovery. And do go to your local support group, like Prostate Cancer Support Organisation. Very helpful with lots of advice, leaflets and regular meetings. They are part of the National Federation of Prostate Cancer Support Groups, known as Tackle Prostate Cancer. And ask your specialist nurses for advice on what support services are available. I've been lucky to meet some extraordinary people and patients. Jewson is a very brave man. He was misdiagnosed and his operation didn't go according to plan. He resolved to share his story all over the web.
What was different about my prostate journey, shall we say? I was theoretically young to be diagnosed. I think busting the myth of the fact that it's an older guy cancer. I had a PSA of 120 and things were looking pretty grim for me. Yes, on average, it's an older guy's thing, but that doesn't mean to say it doesn't happen. So younger guys can get prostate cancer as well. So be aware, I would say from about the age of 40 onwards.
The first few days after Kurt was diagnosed were horrendous. That pure panic, and the fact that we were told it's likely to have metastasised the day after we were told, and we went and sat at a reservoir locally and just cried and just cried and cried, and that was awful. The GP phoned me to say to me that the tumour was 90% of his prostate, so there was very little prostate left, that the Ghassan score was 9 out of 10, and that they didn't get a clear margin. At the same moment as Kurt's lungs were collapsing, and he had multiple clots on his lungs and he was going down for another scan. That was difficult. So we went through a few weeks, well, 5.5 weeks of not knowing if Kurt was going to make it or not.
Yeah, going forwards from that, I had a surgeon that was willing to operate on me, even though it was a very touch and go operation, whether it should happen or not. I did the Facebook post a few years ago, basically to show my friends what I had been going through. At the time I had a colostomy bag hanging off me, a catheter, I just had my prostate out. Well, I thought I'll show all this stuff going on and try and warn them a little bit and sort of say, well, this is the symptoms, visit Prostate Cancer UK, get sort of genned up. I suppose not my naivety with this was that, of course, then they shared it on, and the people who shared it with shared it on, and I think about 25 million people has seen that. It's fantastic it went round, but I didn't quite expect it to happen quite like that.
There are two board meetings that were surprising. One he fell asleep in. We suddenly realised he'd snored because he just couldn't keep awake, so he was very, very tired. And another was after he'd had his second session of chemo, and he went like that, and his hair came out in his hand, and he showed me sort of to the side, and nobody else around the table saw. And we just carried on, and I remember biting back the tears because it felt like such, I don't know why it felt like such a moment, but somehow it did.
Everyone, I presume, goes through that same shock feeling of oh, why me? How does this happen? You know, I cried. Let's not forget. You know, I cried and thought, what's going to happen?
So he suddenly had an epiphany that actually he ought to get all his songs out on the internet and stuff. So he started playing them and stuff in case, I think, and realistically it was in case the kids never saw them or.
And I suppose it wasn't until steps started to be formulated of a possible treatment plan that I began to feel, okay, things are starting to happen, we have a plan, let's go forward with this and see what we can do. As regards taking ownership of my treatment, I was very lucky that I had my wife to think, plan, scheme, read the pamphlets, go through the notes, and that's why I think having someone alongside you, a partner, a friend, anyone who can help you and take a little bit of that load off, having someone alongside you can really help. I think I found it mentally tough afterwards. And the flip side of that is you try to quantify it. I'm absolutely fine. I'm here. You should be out, you know, riding a bike and having the time of your life. But there were moments that I definitely felt like all I want to do is stay in bed, sleep.
Kurt has had counselling, and it has been really helpful. And it's been helpful for both of us because I couldn't cope with all the issues that Kurt had about his treatment, about he had PTSD after his intensive care stint, and that was overwhelming for me to be the only person that Kurt was really talking to.
I had some counselling through Macmillan, which was very, very good. I think talking and sharing is a vital aspect. Getting back into normality for me was fantastic for my mental health. You know, I'm not saying I'm over it now, but life's significantly better. I mean, it's probably, with me, I've had more procedures, therapies than anyone who's had prostate cancer. I mean, I've had the full shenanigans. There's not many I've missed out. And it was tough at the time, psychologically and physically. But in a quite a sort of normal way, I'm physically, you know, back to being, you know, pretty much myself. I have tired days, I have days I don't quite feel like it, but you know, it could be a lot worse. I'm thankful for where I am.
Let's look at another new treatment that's making headlines in transforming the treatment of cancer. We're going to go to the Centre of Immunology at the University of Southampton.
So there are a number of different ways in which immunotherapy actually can be used. Essentially all of them are trying to boost or at least harness the power of the immune system in the fight against cancer. And the way most of those will work is that there's an antibody that's specific for a molecule that's on the surface of a cancer cell and not on the surface of other cells, or at least not as much. And they will target that cancer cell. Essentially, once they bind to the cancer cell, highlight it to the immune system, essentially like a neon sign saying, this is a cancer cell, come and kill it. And that induces an immune response that allows the immune system to detect the cancer cell and destroy it. There are a lot of trials going on now where historically, for people who would have chemotherapy as a course of treatment, and most cancers have an element of chemotherapy, what we know is that kills cells that rapidly divide, cancers being one of those cells, hair follicles being another one. One of the problems with that is that your immune systems also divide very quickly, and so they can be targeted by chemotherapy, and so therefore, that's why you have very bad side effects and people have to sort of separate themselves, at least for a short period of time. So now the trials are ongoing to say what happens if we give what we would describe as a suboptimal dose or subtherapeutic dose, i.e. we're not using the chemotherapy to get rid of all the cancer cells. We're getting it to target some of the cancer cells so that they die, and they die in a way, in what we call in an immunogenic way. And what that means is essentially they die in such a way that actually attracts your immune cells to that area. So then you allow the immune system to then mop up those cancer cells, recognize them as something that's bad, and then any cells that haven't been destroyed by the chemotherapy are actually taken on by your immune system and destroyed. The side effects of the sort of classic treatment, so chemotherapy being usually the one that carries the most obvious side effects or the most difficult side effects, in the sense that the majority of patients who undergo chemotherapy cannot complete as many rounds of chemotherapy as perhaps they need to for the disease. Immunotherapy, the most common side effect is cold flu symptoms, which on the grand scheme of things is a lot better.
You will often have reviews to talk things over with your consultant, especially your latest PSA tests.
Chaloner, come in.
Thank you.
How are you?
Nice to see you.
And you too. Come and have a seat.
Thank you
You've had a
very much.
birthday since we last spoke. So I'm very pleased to say your PSA is still fine.
Good.
It's 0.01,
Right.
which is exactly where we would want it to be during this period of post-radiotherapy hormonal manipulation.
Right.
And if you can see on the graph here, the PSA graph, and you can see that you're really nicely under control now, and the level is 0.0 something. But interestingly, we've got the PSA history back over the last 5 years, going back to when it was just at the upper limit of normal in 2012, 2013, and then when we actually made the diagnosis in March 2015, when we took the biopsies, the level was up at 13. And this drop here is all really at the moment related to the hormonal manipulation, but the radiotherapy effect will take over. But we'll see as we withdraw the hormonal manipulation that the level will just slowly climb to about 1. So far, it's all looking really good. At the moment though, it's important that we acknowledge that this isn't a true judge of what the radiotherapy has achieved yet, because you're still on the hormonal manipulation.
Yes.
And it's the hormonal manipulation which has dropped
Yes.
that level right down
Yes.
to 0.01.
Right.
Now, when we come off the hormone therapy, which is due next March,
Yes.
there'll be a slow, steady increase in PSA,
Yes.
and the testosterone will start to climb
Yes.
after we've stopped the injections,
Right.
and the PSA will rebase at a
Yes.
new post-radiotherapy, post-hormone manipulation level.
So what you're saying is one mustn't get too worried.
Absolutely not.
If it
No.
starts to rise over a period of weeks or months.
No, it's going to be a long time, and it takes sometimes up to 18 months
Right.
after the last injection
Yes.
before the testosterone is switched back on
Kicks
again,
in.
and the PSA will follow that. But as long as it gets up to just around single figures, so a level of about 1 would be
Right.
very good response
Okay.
for the radiotherapy
Yes.
without any hormonal influence in the background.
What sort of things might improve when I come off the hormonal treatment?
I think most men say that the hot flushes are the most disabling, and although it can take up to a year for the hot flushes to disappear after the last injection. That's what most people are relieved stop.
Right.
But if there's a little bit of sort of lethargy and lassitude related to not having the testosterone, getting the testosterone back often helps with that.
Yes.
Some people can be a little bit emotionally labile and a bit irascible because they don't have their testosterone, and a lot of partners are aware that their husband's mental state alters a little bit for not having the testosterone around.
Yes.
And it's interesting that we don't really acknowledge andropause as a phenomenon in this country as we do the menopause. But we do know that when the testosterone is stopped, a patient's personality can change a little bit, and they do become a little bit scratchy and intolerant.
Let's talk about the side effects, the managing, the coping, the understanding. Perhaps the most common issue with prostate cancer. Side effects very much depend on your diagnosis and your individual treatment. When you're told you have cancer, it can become a life-changing experience for you and your family, as well as your close friends. So let's see how we can help ourselves. Each man reacts differently. Some have hardly any side effects at all, but most will have a few. Some you'll learn from, and you'll definitely be wiser. For those men who go on hormonal treatment, many experience hot flashes. Nothing too bad really, but great tiredness, muscle loss, and a loss of strength too. Perhaps a change to your body shape. And changes in your digestion and bowel movements. Oh, and a loss of libido and interest in sex, of course. I did feel sad and a bit moody and depressed at times, and lost my confidence too. The body and mind do take a bit of a battering. So one of the best things for me has been to be active and get outdoors, go walking, biking, swimming. Try and keep fit and healthy. It's helped me to stay positive and socialise a bit. Let's head for the gym and the Westgate Centre in Chichester.
We advocate here that people do 30 minutes of activity 5 times a week. We're not saying that all has to be in the gym, not by any means. The instructors here, they know that people are a little bit fearful come in, and they put you at ease nice and early. You get given a programme, so it's easy to follow, and it kind of demystifies the whole gym process, where I think historically people were, like you say, sort of fearful that they'd walk into a gym full of experienced, knowledgeable, heavily built men grunting and spitting. It's not like that at all. It's here for everybody. It really is. It's a great place to work out and a nice atmosphere. One of the stats is that if someone is in good physical condition and doing that kind of exercise, their actual chance of getting a cancer in the first instance are reduced by 14% in males and 20% in females. Certainly there is evidence to suggest that it can slow the progress. People undergoing treatments benefit greatly from just being a bit fitter. It can aid recovery from the treatments. Taking control, if you like, of your condition is vital. Be that through exercise or other means, so control of diet and so on. As you say, there's the social aspect. There's the endorphins that you get when you exercise. There's the self-image. If you're in good shape, it boosts self-confidence, and all of that I think plays a part in keeping the immune system high and helping you manage your own well-being, particularly at times like that. If you're undergoing treatments and things.
There are many studies that show that exercise, keeping fit and healthy, are powerful weapons in the fight against cancer.
I think for the average UK man, there is quite a big change in lifestyle to actually do the things which are going to reduce the side effects of treatment and enhance the chance of being cured, basically. In terms of the British diet, I'm not criticising our country, but we have a low intake of sort of bacteria-rich food, which they have in Asia and the Far East. We don't use as many herbs and spices as we should, and the levels of things called polyphenols, which we should all eat considerably more of, are quite low in an average British person's diet. So yes, you're right, it's quite a big culture change if you're going to embrace a healthy lifestyle change.
Are we actually saying that if they make these healthy choices, that it might affect and influence the course of their prostate cancer?
Yes, that's absolutely correct. There's different ways you can help yourself. Obviously, during acute cancer treatment, such as surgery, after surgery, or during radiotherapy, you can reduce the early side effects of treatment via a healthy lifestyle. In the long term, you can reduce many of the long-term complications of cancer treatments, and of course, you can improve the odds of your cancer not coming back. There's also another category if you're unfortunate enough to have had metastatic spread. In our research and others are showing you can prolong how long cancer treatments last for before you have to go to the next phase, and also you can improve the tolerance of these treatments, so you can your quality of life improves while you're on them. So there's multiple ways a lifestyle can help someone, not to mention, of course, if you look at large organisations like the World Cancer Research Fund, they're saying now that over 50% of cancers are lifestyle generated. So, of course, you can influence your friends and family to eat healthily, and maybe you could help prevent them get cancer in the first place.
So what have you found in all your research over the years, Robert?
Well, the four factors we concentrate on is reducing processed sugar, improving your gut health, improving your exercise levels on a daily basis, and in particular, significantly increasing the levels of polyphenols within your diet. Now, polyphenols are the gifts from nature which give food its colour, its taste and its aroma. So, you know, we're not asking people to do bad things, it's enhancing their diet in my opinion. And these polyphenols have numerous benefits for multiple pathways of health, reducing risk of Alzheimer's, heart disease, lowering the risk of diabetes. But obviously what we're interested in is cultures who eat a lot of polyphenols have a lower risk of cancer, and if you enhance them after cancer, you have significant benefits in reducing the toxicities of treatment and improving your outcomes. In fact, in the world's largest cancer conference, ASCO, the president of ASCO stood up and said one of the priorities this year in research is to find ways to enhance gut health and investigate how it interacts with other bodily functions. That's largely driven by the fact that cancer treatments are moving into the biological sphere, and that means that we're trying to find ways to get the body to recognize cancer cells as foreign and get your immune system to kill them. So of course, if you have an impaired immune system, these new very expensive cancer treatments are not going to work, and that's been shown in studies. So now it's become very relevant. I mean, it's always been relevant, but it's now relevant in the research sphere.
So if you have a healthy gut, your response and your immune system is stronger, you're going to respond better to the treatment.
Yes.
So we now know that your diet, lifestyle and keeping fit all play a vital part. So having been diagnosed with cancer, many of us ask, why me? How did I get cancer? Let's go and talk to the scientists and see what's happening in the wonderful world of genetics.
So a lot of patients ask me, well, what is the human genome? So it's a bit like the book of life, and your genetic code controls, for example, height, appearance, eye colour, and there are some genes that actually control how a cell, which is a building block of the body, behave. For example, you know, the human genome is just absolutely amazing. If I just brush my skin there, a few skin cells have fallen off onto my lab coat. You can't even see them. And in each skin cell is 3 billion letters, 25,000 genes. So the letters are divided up into genes which code for proteins, which actually control how the cell behaves. And we know that when there's a problem in the human genome, a mutation that's actually increasing cancer risk, then that cell growth goes out of control, and then a cancer can occur or a tumour can grow. So at that stage, over 20 years ago, particularly for prostate cancer, it really was the Cinderella of cancers. We knew nothing about what might cause it. We were only just beginning to appreciate that maybe cancer was what we call a genetic disease. And we know that cancer cells themselves probably become cancer cells. They turn into cancer cells from normal cells because their genetic makeup is deranged. When they're deranged, that control is no longer there, and then a growth can occur. And we now know that a lot of cancers occur because their genetic makeup is deranged.
My genes are actually banked here. I was one of 3 brothers. My other 2 brothers were thankfully diagnosed earlier, but my genes are up here, and they are part of a genetic, national genetic study, prostate cancer genetic study. Can you tell us a little bit about this study and the other trials that are going on?
But we think at the moment probably genetic predisposition to prostate cancer, so that's an alteration now not just in the cancer cells, it's actually in some of your genetic makeup that you potentially might even have inherited. So it's in every cell of your body and on average in half of the sperm. Then there's a genetic alteration that potentially could be passed on to future generations, and if they have an altered gene it could put them at increased risk of developing the disease. And so we hope that at the end of the study we would be able to develop a genetic profiling potential test that we could do on saliva in men in the population and identify who is at increased risk and who isn't, and maybe also identify environmental factors that maybe they could potentially avoid. For example, maybe you'd have a certain genetic makeup and there are certain things that you may be exposed to, maybe things you eat. We don't know yet whether that's the right answer, but then you could potentially use that as a strategy to try to reduce risk or even design prevention agents.
Right. Are we saying that most cancers develop because of a combination of chance, bad luck, our environment, our bad eating practice, not keeping fit, being overweight, and rather than that because we've inherited a specific gene?
Chaloner, I'm really glad you asked that question, because if you'd asked me that question 20 years ago, we would have said that a very small proportion of cancers are due to hereditary genetic alterations. We used to think about 5%. So the answer to your question now, but it's actually much more complicated than we originally thought, and the answer is that a lot of cancers may have some genetic hereditary component, and it's a question of how much in that individual person will be genetic. And then you're absolutely correct that we think the rest of the component is something extraneous, and nobody's really quite sure at the moment. The papers are very controversial about whether it's just chance, bad luck, or whether there may be something environmental. And what's really exciting is that I think the genetic advances are going to help us do very exciting things. They're going to help us identify men who are at really much higher risk of getting prostate cancer. The new advances in imaging and new biomarkers, so they're like samples from blood or potentially even urine samples, that actually could tell us, well, this actually is showing that prostate cancer is starting to develop. We should be very intensive in looking for it. And then also genetic sequencing, both of the cancer itself and somebody's genetic makeup that they might have inherited, to enable us to use a targeted treatment. So that is just a world away from what it was in 1994.
Wonderful. So it's quite clear that new earlier diagnoses and treatments in the future will make things much brighter for the next generation. Let's go back to the practicals and see what works for me and many men. The aim is to give Mother Nature and mind and body a helping hand to recover from the knockabout of the past 2 or 3 years. Let's head down to the CancerWise Support Centre in Chichester. There are similar support advice centres around the country. You might like what you find.
So I became a trustee, and then the opportunity became available to become the chairman, which is a great honour to me, because I can see how hard people work here and how much time they give, so I thought I need to do the same. So yeah, it's been a very interesting time in my life. It's challenging, but it's great fun.
So whether they're being treated or whether they're a relation, a carer, or going through it all, but the fact that anybody can just walk in off the street and come along, have their hand held, be guided towards one of the things that we do, as Richard said, to meet people and to gradually pull themselves together, pick themselves up, and to go forward positively is what we want the cancer sufferers and their carers to do.
CancerWise is a very naturopathic organisation, and we're very lucky to have this in Chichester. There are other organisations in the country, but they are few and far between. So naturopathy is a way of life. It's quite difficult sometimes for people to change, but it's a very gentle approach. So it's non-invasive, and it's really all about understanding people's needs and helping them to develop and to change perhaps some of the ways and remove some of the blockages that have often been put in place. So it's really about releasing and developing and helping people to re-establish their balance in their lives.
My skills and commitment are quite unique in this country, as I combine 3 elements in my treatments, which is deep tissue massage from Switzerland, acupuncture, and the Dawn method from Germany. I always start with a deep tissue massage, and it comes from Switzerland, so it's a specific technique. So it just loosens up muscles and all the layers deep underneath, which are ligaments, tissues and fascias. And it just relaxes the client, you know, headaches might go down, flexibility, motion improves, immune system can be strengthened through that, blood pressure can be lowered. I think because I went personally through a very difficult time, as my husband had cancer himself, I believe it has changed my life. It has become, and also I have become a better practitioner. Therefore, I'm very open-minded and very connected to people who come in with cancer. So I give them a great understanding. I give them time again to talk, because I believe that's the key what people have to do. And I give them the time again to relax and focus really on their ailment.
So take time for yourself. Take time to sort out your thoughts and process what's going on and reflect on your life. And get the support you need from others on your journey. Friends, groups, professional services. Many cancer patients try to reduce the stress. Let one's body heal naturally, whether it's yoga, meditation, exercise, mindfulness. So eat healthy, keep fit, and focus on what's important. Try to lead as normal a life as possible and avoid withdrawing into oneself and becoming isolated. Don't put your life on hold.
What would I say now if someone approached me and say, Kurt, I've been diagnosed with prostate cancer, you know, my world is falling apart. I'd say, do you know what, don't panic. There are things we can do, there are procedures, there's operations, there's treatments, there's a whole host of things ahead of you that can be done. All is not lost. Look at me, I've had all these things done and I'm still ticking along, you know, so don't panic.
For the partner post-diagnosis, I'd say get outside a lot, get lots of fresh air, make sure you take some time to do that and to get some strength on your own, because you do need it and your partner will really need it. And then get informed, whatever it takes, to make sure that you understand, because I don't know if it's the same for everybody else, but for me, knowledge is power, and knowledge keeps me sane.
I think one of the most important things we can do is to talk and share. Have a chat with sons and daughters about it all. My boys, Tom and Jack, and my partner Minnie, and my cousins have all been a great support. It's easier than you might think to start that chat. But it's the great outdoors that gives that wonderful, natural, healing environment. The sea and boating are mandatory therapy for me. It's been a passion for all my life, the coast, the sea, rivers and canals.
So what do you find so special about being at Scenic? What's the magic for you?
The magic for me, I think there's probably 2 or 3 things. One is you never run out of learning stuff. So we could come out here today and it's like this. We could come out here tomorrow and we'll have a completely different rig set up. The tide will be doing something different. So even though I have sailed these waters for nearly 20 years, no 2 times is it the same thing. Yeah. And that sort of a thing where you just keep learning all the time is something that really does it for me. Secondly, another big thing for me is just I find it incredibly calming. So I think there is something about the fact that you have to concentrate constantly, to wit, I'm standing here talking to you and I'm looking under the boom every other minute just to make sure that we're not being crossed by somebody. Okay, and we've got a shore coming up and I'm aware of all these things. So all of this stuff's going through my mind and it pushes all of the other concerns that you may have away. You're not thinking about, oh, my overdraft or, you know, that thing that the boss told me to do at work, or all of that stuff just gets shoved and you're just at one with the sea, really.
There's a sense of power and awe about the sea because it can change hugely and it's a mighty powerful thing. But it's the sea, it's the seashore, it's the seaside. For me, I have to be on it, in it even, and by it. And it's, as you said, it's a kind of escape. You forget stuff on land. And for me right now, while I'm not as strong as I once was, for me it's a great escape. It's a fantastic activity. And it's probably, without a shadow of a doubt, my best therapy. And thanks to you guys for making it happen today.
You're certainly doing okay there, mate.
So looking back on this journey, your family and friends have come to understand you can't do all you once did for the time being. You're in the slow lane. Even while making this film, I and the crew members have noticed how weak I was during the first interviews. But now, having followed the advice, guidance and practices shown, I have learnt, as you will, there are many steps you can take to live well during your treatment. I'm much stronger now, and my energy and zest for life are coming back. But it's the magnificent support that has been one of the features of this journey, and one of the positives, and there are many, has been the kindness of strangers. Sooner or later, we will all need this kindness of strangers.
Thank you.